What if I told you that the blood pressure medication you have been taking every morning, possibly for years, is doing only half the job it should be doing? And that there is a 2-minute physical technique developed and validated in Japan, costing absolutely nothing, that can reduce your systolic blood pressure by the same amount as adding a second prescription. That might sound exaggerated, but the science behind it is real, peer-reviewed, and recommended by both the American Heart Association and the Japanese Society of Hypertension. And today we are going to talk about it openly, clearly, and in a way that gives you something to act on tonight. Hi, I'm Dr. Ethan Parker. I'm an internal medicine physician with 15 years of clinical experience treating high blood pressure, cardiovascular disease, and the cascade of conditions that follow when blood pressure goes unmanaged. I've worked with thousands of patients, most of them over 60, who came to me on 2, 3, sometimes 4 blood pressure medications, and still struggling to reach safe numbers. And what I found again and again, at the root of so much frustration, was that almost no American doctor was telling them about the simple physical interventions that have been clinically proven to work alongside their medication, and in some patients, to reduce the need for it entirely. Here is a statistic that should get your attention. A 2024 study published in Hypertension Research, the official journal of the Japanese Society of Hypertension, examined 60 Japanese adults with high blood pressure, averaging 67 years old, and found that 12 weeks of a specific 12-minute physical protocol lowered morning systolic blood pressure by an average of 4 millimeters of mercury, with some patients showing reductions as high as 8 to 10 points. To put that in perspective, a 4-point reduction in systolic blood pressure is associated with a 10 to 15% reduction in long-term stroke risk. From a kitchen towel, I want to hear from you. What is your current blood pressure reading, and how many medications are you currently taking? Drop your numbers in the comments below. Your experience matters, and you might be surprised how many people are sitting on the exact same numbers you are. Today I'm going to walk you through 3 things. The biological reason your blood pressure stays elevated even on medication. The specific Japanese protocol that addresses that root cause directly. And the 4 mistakes that destroy the entire effect before it has a chance to show up on your home monitor. By the end of this video, you will understand something about your own vascular system that most patients never learn at any doctor visit. Let's begin. Here is the foundation you need to understand, because without it, the technique will not make sense. When blood pressure is elevated after 60, the underlying problem is almost never that the heart is pumping too hard. The problem is that the smooth muscle lining the arteries has lost its ability to relax. Picture the blood vessels not as rigid pipes, but as living, flexible tubes wrapped in a thin layer of muscle. That muscle is constantly receiving signals from the nervous system, telling it when to contract and when to relax. When everything is working properly, the muscle stays loose enough that blood flows under reasonable pressure. When it is chronically tense, the same volume of blood now has to push through narrower openings, and the pressure goes up. The signals that control whether the vessels stay relaxed or stay tense come from a part of the nervous system called the autonomic nervous system. It has 2 branches. The sympathetic branch is the accelerator. It tightens the vessels, raises the heart rate, prepares the body for stress. The parasympathetic branch is the brake. It loosens the vessels, slows the heart rate, allows the body to rest. In a healthy 30-year-old, those 2 branches stay in balance. In a stressed, sedentary 65-year-old, the accelerator is stuck on, the brake has gone soft, and the vessels stay tense around the clock. Most blood pressure medications attempt to fix this with chemistry. They block the receptors that constrict the vessels. They reduce the volume of fluid the heart has to push. They mute the signals from the nervous system at the receptor level. They work, but they do nothing to retrain the underlying system. The moment medication stops, the original tension comes right back. The Japanese discovered something different. They discovered that a specific physical action, performed for a specific duration at a specific intensity, can produce a measurable, sustained recalibration of the autonomic nervous system itself. The vessels begin to behave differently. The baseline tension drops. The blood pressure follows. That action is called isometric handgrip exercise. The Japanese version uses something almost every kitchen has, a rolled-up bath towel. When you grip a towel firmly and hold it, several things happen in sequence. The small blood vessels supplying the muscles of your hand and forearm are mechanically compressed by the contracting muscle around them. Blood flow is temporarily restricted. This sends a chemical signal up through the nervous system. When you release, blood floods back into those vessels in a sudden surge, and the lining of the vessels, called the endothelium, is washed with shear stress. That shear stress triggers the release of nitric oxide, the body's most powerful natural vasodilator. Over time, with repeated cycles of grip and release, the endothelium throughout the entire circulatory system becomes more responsive, more flexible, and more efficient at producing nitric oxide on demand. The result, measured in clinical trials, is a downward shift in baseline blood pressure that persists for hours after each session and compounds over weeks of consistent practice into a sustained reduction. Let me show you the research because I do not want you to take any of this on faith. A 2021 study published in Internal Medicine, the Journal of the Japanese Society of Internal Medicine, examined 53 hypertensive Japanese patients who were already on blood pressure medications and still not reaching target levels. Patients performed isometric hand grip exercises in a controlled protocol for 8 weeks. Morning systolic blood pressure dropped by an average of 2.6 millimeters of mercury. Morning diastolic dropped by 1.8. Evening systolic dropped by 2.4. Evening diastolic dropped by 2.0. All statistically significant. All in patients already on medication. All from a few minutes of squeezing, 3 times a week. A 2024 study published in Hypertension Research examined a lower-intensity version of the same protocol in 60 Japanese hypertensive patients over the age of 60. After 12 weeks, morning systolic blood pressure had dropped by approximately 4 millimeters of mercury. A meta-analysis published in the Journal of Hypertension that pooled data from multiple isometric hand grip studies found that the average reduction across all trials was approximately 7 millimeters of mercury for systolic and 4 for diastolic in hypertensive patients. That effect size is comparable to what you would expect from adding a standard low-dose blood pressure medication. Consider the case of Patricia, a 68-year-old retired schoolteacher from Michigan. Patricia came to me with a systolic blood pressure that had been hovering between 145 and 152 for the last 3 years, despite being on 2 medications. Her cardiologist was preparing to add a third. She was tired of the way the medications made her feel. The lightheadedness in the morning, the persistent dry cough from one of them, the way her ankles swelled by the end of the day. I did not change any of her medications. I gave her the towel protocol, 3 sessions a week, 12 minutes per session. Within 4 weeks, her morning systolic readings had dropped from the 148 to 152 range into the 138 to 142 range. Within 8 weeks, she was averaging 132 systolic in the morning. By the 12-week mark, her morning numbers were consistently in the high 120s. Her cardiologist agreed to reduce one of her medications. Her ankle swelling resolved. The cough disappeared. After age 60, the vascular endothelium loses approximately 30 to 40% of its capacity to produce nitric oxide on demand, according to research from the University of California, San Francisco, published in 2018. This is part of why blood pressure climbs in older adults, even when nothing else has changed in their lifestyle. The good news is that this capacity is recoverable. The same study showed that targeted vascular training, including isometric exercise, restored nitric oxide production in seniors to levels comparable to adults 2 decades younger after sustained practice. Here is the exact protocol. Take a regular bath towel and roll it up tightly along its long axis until you have a cylinder approximately the thickness of a soft drink can. Sit comfortably in a chair with both feet on the floor, your back supported, your forearm resting at roughly elbow height. Take the towel in your non-dominant hand first. If you are right-handed, start with your left. Squeeze the towel at approximately 30% of your maximum effort. This is the single most important instruction in the entire protocol. You are not trying to crush the towel. You are applying a firm, sustained, comfortable pressure you could maintain for 2 full minutes without straining. Aim for the level of grip you would use to firmly hold a heavy grocery bag. Hold that squeeze for 2 full minutes. 1 continuous, steady contraction. Breathe normally throughout. Do not hold your breath. After 2 minutes, fully release and rest for 1 minute. Switch hands. Repeat the same 2-minute hold with your dominant hand. Rest 1 minute. Then repeat the entire sequence 1 more time. By the end, you have completed 4 total 2-minute holds, 2 on each hand. The entire session takes about 12 minutes. Perform this 3 times a week, not every day. The vascular adaptation requires recovery between sessions. Monday, Wednesday, Friday is a perfectly good schedule. Now let me tell you about another patient, Robert, a 72-year-old retired contractor from Pennsylvania. When Robert came to me, his blood pressure was uncontrolled despite 3 medications. He had been told by his cardiologist that his arteries were simply too stiff at his age, and that the medications were doing as much as they could. His systolic numbers were running 158 to 165 most mornings. He had been considering a 4th medication when his daughter sent him a research article on isometric training. He came to me to ask if it was real. We tested his grip strength, established his 30% intensity target, and started him on the protocol. He kept a careful log. By week 6, his morning systolic readings had dropped into the 140s. By week 12, they were averaging 134. His cardiologist initially did not believe the numbers and asked Robert to bring his home monitor in for verification. The numbers held up. 3 months later, one of his medications was discontinued. Robert told me the most important change was psychological. He had gone from feeling like a passive recipient of his own decline to feeling like he was actively building his own recovery. Here is the powerful pairing that almost no one talks about. The blood pressure reduction from this protocol is dramatically amplified when combined with 2 evening habits that work on the same parasympathetic nervous system pathway. The first is slow nasal breathing for 5 minutes before dinner. The second is reducing your evening sodium intake. Both of these calm the same nervous system that the hand grip exercise retrains, and together they create a compounding effect that no single intervention produces alone. Now the mistakes that destroy this protocol. Mistake 1. Squeezing too hard. The 30% target is not arbitrary. Studies that used 5% intensity, where patients were barely squeezing, showed no benefit. Studies that used 50% or higher saw patients quit because the holds became unsustainable. 30% is the sweet spot. If your knuckles turn white, you are squeezing too hard. If your forearm is burning halfway through, drop the intensity immediately. Mistake 2. Doing it every day. More is not better. The vascular adaptation requires recovery time between sessions. Patients who try to do this daily often see no benefit or worse results because they never allow the adaptive response to occur. Mistake 3. Holding your breath during the holds. Holding your breath against a sustained muscular contraction produces what is called a Valsalva response, which actually spikes blood pressure acutely. Stay relaxed. Breathe slowly and naturally throughout. Mistake 4. Not tracking. I cannot tell you how many patients have told me, 3 months in, that they think the protocol probably is not working, only for me to discover they have not been tracking. They are guessing based on how they feel. Blood pressure does not produce reliable subjective sensations until it is dramatically out of range. If you are not measuring, you are not actually doing the protocol. Let me also tell you about Eleanor, a 75-year-old woman from Florida who had been on the same blood pressure medication for 19 years. Her numbers were technically controlled, but she had developed a chronic dry mouth, fatigue, and what her primary care doctor described as medication-related kidney strain. She wanted to find a way to reduce her dependence on the prescription without losing her blood pressure control. We started her on the hand grip protocol along with a daily 20-minute walk after lunch. After 4 months, her blood pressure had stabilized at a slightly lower baseline than she had on medication alone, and with her physician's involvement, her dose was cut in half. 6 months in, the dry mouth had resolved, her energy had returned, and her kidney markers had normalized. Eleanor's story is not exceptional. It is what happens when a patient over 60 commits to physical retraining of the vascular system alongside their medical care. Let me bring this together. High blood pressure after 60 is not a permanent sentence of more medications and more side effects. It is a measurable state of autonomic nervous system imbalance, with downstream effects on the smooth muscle lining of your blood vessels. There is a Japanese clinical protocol, validated in peer-reviewed research, and recommended by both the Japanese Society of Hypertension and the American Heart Association, that uses a simple rolled-up bath towel to retrain the vascular response and lower baseline blood pressure. The protocol is 12 minutes per session, 4 2-minute holds at 30% of maximum grip intensity, alternating hands, separated by 1-minute rests, 3 sessions a week. Tracked with home blood pressure readings every morning and evening. Avoid the 4 mistakes: squeezing too hard, doing it every day, holding your breath, and failing to track. The research from Japan consistently shows reductions in systolic blood pressure of 2 to 7 millimeters of mercury over 8 to 12 weeks, which translates into 10 to 15% reductions in long-term stroke risk. This is not theory, this is data. From a kitchen towel. I want to hear from you. What is your current morning blood pressure, and how many medications are you on? Tell me in the comments. I read every single one. If this information gave you something concrete to work with, please hit the like button, subscribe to this channel, and share this video with someone you love who is fighting blood pressure. Most of them have never heard a doctor explain this honestly, and most of them never will unless someone like you sends it to them. And remember this, your body is not failing you. It is waiting for the right signal. Today you learned how to send it.